basics of a network is that once you are linked in the network starts to shape your views and starts to shape your interactions with everybody else. That's one of the things that defines what a network is. A network is not just the product of its component parts. It is actually a product of, it is something more than that. It is, as Stephen Johnson has talked about, an emergent phenomenon. Now, this has all these benefits. It's very beneficial in terms of the efficiency of communicating information. It gives you access to a whole host of people. It allows people to coordinate their activities in very good ways. But the problem is that groups are only smart when the people in them are as independent as possible. This is sort of the paradox of the wisdom of crowds, or the paradox of collective intelligence, that what it requires is actually a form of independent thinking. And networks make it harder for people to do that because they drive attention to the things that the network values. So one of the phenomenons that's very clear in the blogosphere is that once a meme, once an idea gets going, it is very easy for people to just sort of pile on because other people have, say, a link. People have linked to it, and so other people in turn link to it, et cetera, et cetera. And that phenomenon of kind of piling on the existing links, is one that is characteristic of the blogosphere, particularly of the political blogosphere, and it is one that essentially sort of throws off this kind of beautiful, decentralized, bottom-up intelligence that blogs can manifest in the right conditions. The metaphor I like to use is the metaphor of the circular mill. A lot of people talk about ants. You know, this is a conference that's inspired by nature. When we talk about bottom-up, decentralized phenomenons, this sort of ant colony is a classic metaphor. Because, you know, no individual ant knows exactly what it's doing, but collectively, ants are able to reach incredibly intelligent decisions. They're able to sort of reach food as efficiently as possible. They're able to guide their traffic with remarkable speed. So the ant colony is a great model. You have all these little parts that collectively add up to a great thing. But we know that occasionally ants go astray. And what happens is that if army ants are sort of wandering around and they get lost, they start to follow a simple rule. Just do what the ant in front of you does. And what happens is that the ants eventually end up in a circle. And there's this famous example of one that was 1,200 feet long and lasted for 2 days. And the ants just kept marching around and around in a circle until they died. And that, I think, is a sort of thing to watch out for. That's the thing we have to fear, is that we're just going to keep marching around and around until we die. Now, I want to connect this back, though, to the tsunami. Because one of the great things about the tsunami, in terms of the blogosphere's coverage, not in terms of the tsunami itself, is that it really did represent a genuine bottom-up phenomenon. You saw sites that had never existed before getting huge amounts of traffic. You saw people being able to offer up their independent points of view in a way that they hadn't before. And there you really did see the intelligence of the web manifest itself. So that's the upside. The circular mill is the downside. And I think that the former is really what we need to strive for. Thank you very much.
And treatment of heart disease, just a fishtail? Thanks to recommendations like this from the American Heart Association, that individuals at high risk for heart disease ask their physicians about fish oil supplementation, it's grown into a multi-billion-dollar industry. We now consume over 100,000 tons of fish oil every year. But what does the latest science say? A systematic review and meta-analysis published in the Journal of the American Medical Association looked at all the best randomized clinical trials evaluating the effects of omega-3s on lifespan, cardiac death, sudden death, heart attack, and stroke. Either advice to eat more oily fish or to take fish oil capsules. What did they find? Overall, they found no protective benefit for overall mortality, heart disease mortality, sudden cardiac death, heart attack, or stroke. What about for those who've already had a heart attack, though, and are trying to prevent another one? Still, no benefit. Where did we even get this idea that omega-3s were good for the heart? Well, if you look at some of the older studies, the results looked promising. For example, the famous DART trial back in the 80s involving 2,000 men. Those advised to eat fatty fish at a 29% reduction in mortality. Pretty impressive. No wonder it got a lot of attention. But people seem to have forgotten about the sequel, the DART 2 trial. Same group of researchers, an even bigger study, 3,000 men, and those advised to eat oily fish, and particularly those supplied with fish oil capsules, had a higher risk of cardiac death. Put all the studies together, and there's no justification for the use of omega-3s as a structured intervention in everyday clinical practice, or for guidelines supporting more dietary omega-3s. So what should doctors say when their patients follow the American Heart Association advice to ask them about fish oil supplements? Well, given the new meta-analysis and other negative meta-analyses, our job as doctors should be to stop highly marketed fish oil supplementation in all of our patients. Leading causes of death. Exploring the latest science on the role diet may play in preventing, arresting, and even reversing some of our top 15 killers. Or if you remember, actually our top 16 killers, since side effects from prescription drugs kill an estimated 106,000 Americans every year, the sixth leading cause of death may actually be doctors. And that's just from adverse drug reactions. Add in medical mistakes, which the Institute of Medicine estimates kills at least 44,000 Americans every year, and that brings doctors up to here. Throw in some hospital-acquired infections, and we're talking maybe 187,000 Americans dead every year and millions injured by medical care. Even preventive medicine kills in its own way. The best way to avoid the adverse effects of medical and surgical tests and treatments is not to avoid doctors, but to avoid getting sick in the first place. So this year I thought I'd run through the top dozen reasons people visit their physicians to highlight some of the latest research in hopes of moving me down the list of common killers.